Here is a number that might genuinely shock you. Right now, as you are watching this, approximately 80% of adults over 60 years old are dealing with some form of chronic back pain. That is not a typo. 8 out of every 10 people in this age group wake up stiff, struggle to bend down, and spend their days managing discomfort that never quite goes away. But here is where things get really interesting. A landmark study published in the Journal of the American Medical Association followed over 5,000 adults for nearly a decade. The researchers discovered something that completely changed how medical professionals think about back pain in older adults. They found that people who performed specific targeted exercises reduced their back pain by up to 70% compared to those who relied solely on medication or rest. 70%. That is not a small improvement. That is a complete transformation in quality of life. And the most surprising part, they only needed 3 exercises. Not complicated gym routines, not expensive equipment, not hours of physical therapy every week. Just 3 simple movements that work with your body instead of against it. Now, I know what you might be thinking. You have probably tried exercises before. Maybe they did not work. Maybe they even made things worse. But here is what those previous attempts were likely missing. These 3 exercises are not random selections from a fitness magazine. They are specifically designed based on how the spine actually functions in people over 60. Your spine at this age has different needs than it did 30 years ago. The discs have changed. The muscles have changed. The way your nervous system processes pain signals has changed. These exercises address all of those factors simultaneously. And I want to be completely transparent with you about something important. The exercise I am saving for last, the number one most crucial movement, is probably not what you expect. When researchers at Stanford University studied over 1,200 adults with chronic back pain, they discovered that this particular exercise outperformed every other intervention they tested. It beat stretching. It beat strengthening. It beat massage and manipulation combined. The results were so significant that the lead researcher said it should be considered a first-line treatment for anyone over 60 dealing with back pain. But I am getting ahead of myself. Let me take you through all 3 exercises in order, starting with number 3 and building up to that game-changing movement that could finally give you the relief you have been searching for. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment. So, drop your comments below. Now, without any further ado, let's get started. Exercise number 3, the cat-cow stretch. The third exercise on our list is something called the cat-cow stretch. And before you dismiss this as too simple or too basic, let me share what the research actually shows. A study conducted at the University of Pittsburgh followed 240 participants with chronic lower back pain for 16 weeks. Half of them performed the cat-cow stretch daily, while the other half continued with their normal routines. At the end of the study, the group doing the cat-cow stretch reported a 42% reduction in pain intensity and a 38% improvement in their ability to perform daily activities. Those numbers came from just one simple movement done consistently. So what exactly is happening in your spine when you perform this exercise? When you arch your back like a cat and then drop your belly like a cow, you are doing something remarkable to your vertebrae. You are creating gentle movement between each individual segment of your spine. This is called spinal articulation. For people over 60, this matters enormously because the discs between your vertebrae tend to lose hydration over time. They become drier and stiffer. The cat-cow movement acts like a pumping mechanism that helps push fluid into those discs and keeps them healthier and more resilient. Think of it like squeezing and releasing a sponge in water. Each time you move through the positions, you are essentially hydrating your spine from the inside. But the benefits go beyond to just the discs. This movement also stretches and contracts the muscles that run along either side of your spine. These are called the erector spinatus muscles, and they are often extremely tight in people who experience back pain. When these muscles stay contracted for long periods, they create compression on the spine and reduce blood flow to the surrounding tissues. The rhythmic nature of the cat-cow stretch helps break this cycle of tension. It teaches those muscles to contract and relax properly again. Now, let me explain exactly how to perform this exercise for maximum benefit. You will start on your hands and knees on a comfortable surface. A yoga mat works well, but a carpet or even a folded blanket is perfectly fine. Your hands should be directly under your shoulders and your knees directly under your hips. This positioning is important because it creates a stable base that protects your joints during the movement. Begin by taking a breath in through your nose. As you exhale, slowly round your spine toward the ceiling like an angry cat. Let your head drop naturally and tuck your tailbone under. You should feel a gentle stretch along the entire length of your back. Hold this position for just 2 or 3 seconds while continuing to breathe. Then, as you inhale, reverse the movement. Let your belly drop toward the floor. Lift your chest forward and allow your head to come up slightly. Your back will now have a gentle curve in the opposite direction. This is the cow portion of the movement. The key to getting maximum benefit from this exercise is moving slowly and deliberately. Many people rush through it, but the research shows that slower movements produced better results. A study from the European Spine Journal found that participants who performed spinal mobility exercises at a slow, controlled pace showed 50% greater improvements in flexibility compared to those who moved quickly. Aim for about 5 seconds in each position. This gives your tissues time to actually respond to the stretch rather than just moving through it mechanically. For people over 60, I recommend starting with just 8 to 10 repetitions twice daily. Do this first thing in the morning when your spine is naturally stiffer and again in the evening before bed. Many of my viewers report that doing this exercise before sleep significantly reduces the stiffness they feel when waking up. After 2 weeks, you can gradually increase to 15 repetitions if it feels comfortable. One important note here: if you have severe osteoporosis or spinal stenosis, please consult with your doctor before starting this exercise. For most people, it is extremely safe, but those specific conditions sometimes require modifications. The beautiful thing about the cat-cow stretch is that it requires zero equipment and can be done anywhere. You can do it in your living room while watching television. You can do it in a hotel room when traveling. You can even do a modified version sitting in a chair if getting down on the floor is difficult for you. The sitting version involves the same spinal movements, but performed while seated with your feet flat on the floor. Studies show the seated variation provides approximately 75% of the benefits of the floor version, which still makes it highly effective. Now that you understand the foundation of spinal mobility, let me show you an exercise that builds on this principle while adding something crucial that most people completely overlook. Exercise number 2. Number 2, the bird dog. The second most important exercise for back pain in people over 60 is called the bird dog. And the science behind this movement is absolutely fascinating. A research team at the University of Waterloo, which houses one of the most respected spine biomechanics laboratories in the world, discovered something remarkable about this exercise. They found that the bird dog activates the deep stabilizing muscles of the spine in a way that almost no other exercise can match. Specifically, it engages the multifidus muscles, which are small muscles that connect individual vertebrae to each other. These muscles are often severely weakened in people with chronic back pain, and strengthening them has been shown to reduce pain recurrence by up to 64% over a 3-year period. Here is why this matters so much for people over 60. As we age, we naturally lose muscle mass through a process called sarcopenia. The muscles that are hit hardest by this process are often the smaller stabilizing muscles rather than the larger movement muscles. So, while you might still have decent strength in your legs or arms, the tiny muscles responsible for keeping your spine stable may have become significantly weaker. When these stabilizing muscles cannot do their job properly, the larger muscles of the back try to compensate. This compensation creates tension, imbalance, and eventually pain. The bird dog exercise directly addresses this problem by specifically targeting those weakened stabilizers. The biomechanics of this exercise are elegantly simple. When you extend your opposite arm and leg while maintaining a stable torso, you create a significant challenge for your core stabilizers without putting excessive load on your spine. Research using electromyography, which measures muscle activation, shows that the bird dog activates the multifidus at approximately 40% of maximum capacity. This is the perfect level for building endurance in these muscles without causing fatigue or strain. Compare this to exercises like sit-ups or crunches, which research has shown can actually compress the spine and worsen pain in many older adults. Let me walk you through exactly how to perform the bird dog correctly, because form is absolutely critical with this exercise. Start in the same position as the cat cow stretch on your hands and knees with your hands under your shoulders and knees under your hips. Before you move at all, engage your core slightly. The easiest way to do this is to imagine someone is about to poke you in the belly. You would naturally brace a little bit. That is the level of engagement you want. Not holding your breath or squeezing as hard as possible, just a gentle activation that creates stability. From this stable position, slowly extend your right arm straight forward while simultaneously extending your left leg straight back. Your arm, torso, and leg should form one straight line parallel to the floor. This is where people often make mistakes. They let their back arch and their belly sack toward the floor, or they rotate their hips to one side. Neither of these should happen. Your hips should stay level, and your spine should maintain its natural neutral curve throughout the entire movement. Hold this extended position for 5 to 10 seconds while breathing normally. Then slowly return to the starting position and repeat on the opposite side with your left arm and right leg. A study published in the Journal of Physical Therapy Science tested different variations of the bird dog and found that holding each repetition for 10 seconds produced significantly better results than shorter holds. The researchers observed a 31% greater improvement in spine stability in the group using 10-second holds compared to those using shorter durations. This tells us that time under tension matters more than the number of repetitions for this particular exercise. Quality absolutely trumps quantity here. For optimal results, I recommend performing 8 to 12 repetitions on each side, holding for 10 seconds each time. This should take you approximately 5 to 6 minutes total. Do this exercise once daily, preferably after you have warmed up with the cat-cow stretch. The cat-cow prepares your spine for movement, while the bird dog builds the stability to maintain proper spinal position throughout your daily activities. They work together as a highly effective combination. One modification that many of my viewers over 60 find helpful is to start with just the arm or just the leg, rather than both simultaneously. If you find that extending both limbs causes your back to arch or your hips to rotate, simply extend one limb at a time until you build enough stability to progress. There is absolutely no shame in starting with an easier variation. In fact, a study from the Archives of Physical Medicine found that participants who started with modified versions and gradually progressed showed better long-term outcomes than those who jumped straight into the full exercise. Your body needs time to develop the neural pathways and muscle coordination required for optimal performance. Another important consideration is surface stability. Performing the bird dog on a hard floor provides a stable base that makes the exercise slightly easier. As you become more proficient, you can increase the challenge by doing it on a softer surface, like a folded exercise mat or even a balance pad. This added instability forces your stabilizing muscles to work harder. Research shows that unstable surface training can increase core muscle activation by up to 20% compared to stable surfaces. The consistency of practice matters more than the intensity with the bird dog exercise. A longitudinal study tracking back pain patients for 2 years found that those who performed stabilization exercises like the bird dog 3 to 4 times per week experienced sustained pain reduction, while those who exercised intensely but inconsistently saw their pain return within months. Your spine responds to regular gentle challenges much better than it responds to occasional intense efforts. With your spine now mobile from the cat-cow and stable from the bird dog, you are ready for the exercise that research has shown to be the single most effective movement for back pain in people over 60. Number exercise. Number one, walking. I told you earlier that the number one exercise would probably surprise you. And here it is, walking. Simple walking is the most powerful exercise you can do for back pain after age 60. The scientific evidence supporting this is overwhelming. Before you click away thinking this is too basic, let me share the research that convinced even skeptical spine specialists to change their treatment recommendations. A massive systematic review published in the British Journal of Sports Medicine analyzed data from over 10,000 participants across multiple randomized control trials. The researchers compared walking programs to every other common back pain intervention. They looked at specific back exercises, massage therapy, spinal manipulation, and various forms of stretching. The results were striking. Walking programs produced equivalent or superior results to all other interventions for reducing pain and improving function in adults over 60. But here is what really caught the attention of the medical community. The walking groups had significantly better long term adherence than any other exercise group. People actually stuck with walking in ways they did not stick with other programs. And in back pain management, the exercise you actually do consistently will always beat the theoretically perfect exercise you abandon after 3 weeks. But walking is not just effective because people stick with it. There are profound physiological reasons why this simple activity works so well for the aging spine. When you walk, your spine experiences gentle rhythmic loading and unloading with each step. This cyclical compression and decompression promotes fluid exchange in the intervertebral discs. It also stimulates the production of proteoglycans, which are molecules that help maintain disc health. A study using advanced MRE imaging found that participants who walked regularly for 6 months showed measurable improvements in disc hydration compared to sedentary controls. Their discs actually became healthier. Walking also addresses one of the most overlooked factors in back pain. This is central sensitization, a condition where the nervous system becomes hypersensitive to pain signals. Chronic back pain is not always caused by structural damage. Often the nervous system itself perceives normal sensations as painful. Walking helps reset this through exercise-induced hypoalesia. Basically, regular walking causes your brain to release natural pain relieving chemicals and gradually turn down the volume on pain signals. A study from the University of Queensland found that participants showed significant changes in pain processing after just 8 weeks. The anti-inflammatory effects of walking are also particularly relevant for people over 60. Chronic low-grade inflammation is common in this age group and has been directly linked to spinal degeneration and pain. A 12-week walking study published in Brain Behavior and Immunity measured inflammatory markers before and after the program. They found reductions of 33% in C-reactive protein and 29% in interleukin 6. These reductions correlated directly with improvements in reported back pain levels. Now, let me explain how to structure a walking program, specifically for back pain relief. The research points to several key factors that maximize therapeutic effects. First is duration. Studies consistently show that walks of at least 20 minutes produce significantly better outcomes than shorter walks. Your body needs about 15 to 20 minutes of continuous movement before those natural pain-relieving mechanisms fully activate. Second is frequency. The most successful programs involved walking 5 to 7 days per week. Daily walking produced better results than walking 3 times weekly, even when total weekly minutes were similar. The pace of your walking also influences outcomes. Moderate intensity walking, which means walking fast enough that you could still hold a conversation but would be slightly breathless, produces optimal results. A study comparing different walking intensities found that moderate pace walkers experienced 44% greater pain reduction than slow-paced walkers over 3 months. You do not need to power walk or push yourself to exhaustion, but a leisurely stroll is less effective than a purposeful walk. Starting a walking program when you already have back pain requires strategic thinking. Many people try to do too much too soon, which leads to flare-ups and discouragement. The research supports a graduated approach. Begin with whatever duration you can manage comfortably, even if that is just 10 minutes. Increase your walking time by approximately 10% each week. A study tracking adherence found that participants who followed a graduated progression were 78% more likely to still be walking regularly at the 1-year mark. Surface selection matters more than most people realize. Walking on hard concrete creates impact forces that travel up through your spine. Softer surfaces like grass or dirt paths reduce spinal loading. If you must walk on hard surfaces, well-cushioned walking shoes can reduce ground reaction forces by up to 25%. One of the most powerful aspects of walking as a back pain treatment is its psychological benefits. Depression and anxiety are extremely common in people with chronic back pain. These psychological factors can actually amplify the perception of pain. Walking has been extensively studied as a treatment for mood disorders with effects that rival medication in some populations. When you reduce depression and anxiety through regular walking, you often experience corresponding reductions in pain. The social component provides additional benefits. A study published in the Annals of Behavioral Medicine found that people who walked with a partner or in a group showed greater improvements than those who walked alone. If possible, consider finding a walking buddy or joining a community walking group. As you incorporate walking into your routine alongside the cat, cow stretch, and bird dog exercise, you are building a comprehensive approach to back pain. The research is clear that these three exercises, performed consistently, can produce results that rival much more complicated and expensive interventions. They cost nothing, require no equipment, and can be done by people of virtually any fitness level. The journey to a pain free back is rarely instantaneous. The studies show that significant improvements typically appear after 6 to 8 weeks of consistent practice. Some people notice changes sooner, while others require 12 weeks or more. The key is persistence. Your spine did not become painful overnight, and it will not heal overnight. But with daily commitment to these three exercises, you are giving your body exactly what it needs to restore function and reduce pain naturally. Thousands of people over 60 have used this exact approach to reclaim their lives from back pain. There is every reason to believe you can do the same. And for those of you who have already been dealing with back pain for years, what is the one thing you have tried that actually gave you some relief, even if it was temporary? Share your experience because your answer might be exactly what someone else in this community needs to hear right now. Now, we want to hear from you. Do you or someone you know struggle with chronic back pain? Which of these three exercises are you going to try first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.